counselor Tracy Fauntleroy knows the struggle the pandemic has placed on countless others. The stress of being isolated is real, especially for those struggling with mental health issues.
It's a time of uncertainty, and people have a tendency to panic when they don't know what's going to happen. They have a tendency to go into anxiety when they can't control their circumstances.
A very real response, Fauntleroy, who runs Transforming Lives into Purpose, says is that some could slip back into old habits like substance abuse. But now there is some relief. Virginia just received a $2 million grant from the federal government to address behavioral impacts of COVID-19. The money will help provide treatment through community services boards and enable virtual interventions for alcohol use disorder, depression, and other disorders.
It's necessary and it's needed. And I'm grateful that they're recognizing the need right now.
Fauntleroy says as she counsels an increasing number of clients through this pandemic, she also encourages friends and relatives to routinely check in on those who may be suffering.
They don't even want to accept that something is wrong. They don't want to accept that they're depressed. They don't want to accept isolation is a form of depression. When you have someone that's not taking your calls, when you have someone that say, no, I don't want to be bothered, when you check on them, because to me, that's an indication that something's going on internally that they're not willing to express outwardly.
During this Mental Health Awareness Month, Fauntleroy uses her writing and Transforming Lives into Purpose podcast to make sure people suffering from mental health issues know that help is available and they're not alone. If you know someone in the community who may be struggling with mental illness and may need help, there is a national crisis hotline that you can share. That number is 1-800-273-TALK.